Audience are here. Audience are waiting. We are live.
Good afternoon, everyone. I am Djimbaye, founder of the Universal Talks, and I welcome you all in the webinar, addressing the role of vaccine in COVID-19 prevention, how to weed through misinformation and mistrust. This webinar mainly focuses on creating awareness and reducing the misconception about the vaccination among the people. So that we can minimize the loss which is caused by the deadly pandemic COVID-19. The COVID-19, how creating impact in varied geographical situation. Today, we have with us as our chief guest, Ms. Susana Goncalvas, Director, Municipal Department of Civil Protection, Matosinhos, Portugal. As our keynote speaker, we have Mr. Gildas Djimbaye, Scientific Laboratory Technician, Ministry of Public Health, Chad. And as our speaker, Dr. Mohammad Arif, Assistant Professor in Central University of Jharkhand in the Department of Geography. Now, I would like to tell about the Universal Talks. The Universal Talks is a website with a difference. The Universal Talks has volunteers all across India who are working restlessly to bring a change in every dimension of the nation. Vision of the Universal Talks is the extermination of all the mental and physical ailments of the global population and to make them realize the true power of being a human. The Universal Talks is getting recognized by global population from all 6 continents of the world. And now, I would like to call Mr. Harjeet Singh Hura, Secretary, Columbia College, Raipur, Chhattisgarh, so he can give some insight about the Columbia College.
Thank you, Ojas ji. Good afternoon, everyone. I welcome you all, and I welcome chief guest of this webinar, Ms. Susana, keynote speakers. I'm very much thankful to both the conveners, Dr. Arun Dubey and Ojas, for organizing this beautiful webinar in this in this pandemic period, and this is very important issue and a very relevant issue at this juncture, because we all are facing huge problem because of this COVID-19, and we all have to make efforts towards awareness of vaccination so that we can minimize the loss by this COVID-19 towards mankind. I'm very happy to join this very important webinar organized by Columbia College. I'm very privileged to introduce our group, Columbia Group of Institution, before you all. Our group started with a small course diploma in pharmacy in 2004, and then we gradually added bachelor's in pharmacy, bachelor's in engineering, master's in business administration, master's in pharmacy, diploma in engineering, bachelor of education, bachelor's in nursing, and then a school which is affiliated to CBSE. We at Columbia entrust on quality education, for which we make a dedicated team. And we regularly organize various seminars, workshops, national and international conferences to provide platforms to our faculty members, researchers, students for the updates in their respective fields. In pharmacy, we have approved research center also by our Technical University of the state. And 5 of our faculties have completed their PhDs from our pharmacy department. And 14 are there engaged in their PhD work right now. Our team, which gets various projects from various councils, from AICT, PCI, state bodies, CCOST and all, and various projects and seminars, and are going on continuously for the updates and upgradation of our students, researchers, and faculty members. Corona has affected our lives a lot. We can protect ourselves with vaccinations, and I'm very happy to know that almost 7% of our staff have been vaccinated. And because there are misconceptions towards vaccinations, so, and especially non-teaching and lower grades of our staffs, they got misconception especially in rural areas. So we are encouraging them and motivating them to get vaccinated, and we are being very much successful in that. I'm very much thankful to be part of this webinar, and I'm very much thankful to both the conveners and chief guests and all the key speakers for joining and sparing their valuable time and sharing their valuable thoughts for the betterment of mankind. I thank you all once again. Thank you very much, and hope this webinar will be very much beneficial to all those who are attending this one. Thank you so much. Thank you.
Thank you, sir. Now, I would like to call Dr. Arun Kumar Dubey, Principal, Columbia College of Education, to say a few words.
Thank you, Mr. August. Good afternoon, everyone. It's a moment of extreme pleasure to welcome the guests and participants who have associated with us in this webinar. On behalf of the Columbia College, I offer my regards to Chief Guest Honorable Susana Goncalvas, Keynote Speakers Honorable Gildas, Djimbaye, Togde, today's speaker Honorable Dr. Mohammad Arif, Secretary, Jan Pragati Education Society, Honorable Harjit Singh Hura sir, all the advisory board members, Dr. Abha Dubey, Dr. Riya Tiwari, Dr. Kavita Pandey, Dr. Divya Pandey, and organizing committee of my college, Mrs. Ranjana Thakur, Dr. A. Taranand, Maya Devi, Gajendra, Upasna Srivastav, and Rekha Yadav, and all the participants and research scholars who have attached associated with this webinar. As Mr. Ojas Dubey mentioned and Harjit sir mentioned in their speech, the objectives and importance of this webinar. Objective of this webinar is to create awareness amongst the people about COVID-19 and vaccination, so that we are contributing our little effort to save the humanity. Columbia College organizes this webinar in collaboration with the Universal Talks. Columbia College was established in the year of 2013 with the vision of providing ideal education to cultivate the overall development of the pupil, teacher possesses with potential knowledge, leadership qualities, and explore the competencies to spread the wisdom of all around the society. I wish the webinar enlightens all of us and provide us with approaches to deal with this pandemic situation. Thank you so much to all the dignitaries and participants for accepting our invitation and coming over here for the webinar. Thank you so much.
Thank you, sir. And now I would like to give a brief introduction about our today's chief guest. Ms. Susana Maria de Souza Goncalves concluded her degree in environmental health at Polytechnic Institute of Oporto in 2001. As of now, she is serving as the director of uh, Municipal Department of Civil Protection in Matosinhos, Portugal. She was a trainer of several courses in several institutions in areas such as prevention and safety against fire and toxicity, fire safety and first aid, environment, hygiene and safety at work, health and safety at work, and rescue swimming techniques. And now I would like to call our chief guest for our lecture. Over to you, ma'am.
Thank you, Arif. Can I share my screen, please? Okay. Just a second, please. Sorry, just a minute. Okay. Now it's well, first of all, I would like to thank for your kind invitation for me to be a part. It's an honor for me to be a part of this very important webinar because COVID-19 changed our lives in the last 1.5 years. And now we are in the vaccine process. That is a very important process and a very important step for us to get some normality in our lives. So I think everything we can share about this this major event that we are living with the vaccination program, it's very important so we can share our experience, we can share our knowledge, and in this case, we can bring to people a better information about the importance of the vaccine. So today I will talk about how the impact of COVID-19 made Portugal enter in an emergency state for a very long time, how we managed to do our vaccination program and the role of the vaccine in our country. So Portugal is a small country in the south of Europe. It's the last country in the ocean Atlantic. And Matosinhos is a city in the north of Portugal, a city by the sea. So there's some pictures about our country, and if you want to visit it, we will be very glad. So the pandemic in Matosinhos increased a lot the hospitalizations of mostly elder people and made incredible pressure in the health service in Portugal. We have many people for over 15 years that were hospitalized and need care. As the studies know and show us, 80% of the people who have COVID-19 doesn't need hospitalization, but the ones who need, about 5% of the population, the one who needs, they already have developed critical illness. So we have diseases, and we have respiratory failure, we have multi-organ failure, so it's a very intense disease. In Portugal, this was a reality. The people over 15 years of age 74 to 65% of the cases were in this stage. So we have a lot of hospitalizations. Until today, in Portugal, we had 8,073, around 8,073 people with the disease, and we had 48,435 deaths in our country. In Matosinhos, 13.5% of the population get infected until today, and around 16% of the population died, 218 persons died. So that we can do a comparison between the country and Matosinhos. Portugal had almost 11 million people, and Matosinhos 175,000 people, inhabitants. About vaccination progress. In Portugal, as in around the world, vaccination is universal. So anyone who lives in Portugal in the current days can be vaccinated if they are clinically indicated for the vaccine. The vaccination is also free, is completely free of charge for the population. And the vaccination is accessible to everyone. In Portugal, we have a system that has been growing for the vaccination progress. In the first line, they were the people who were vaccinated were called by the National Health Service. They were called and they were scheduled with a time and a place to get vaccinated. Now, because we are working with younger population, everyone who wants to be vaccinated as a platform and schedule the vaccination in the platform sends you a message, you confirm the vaccination, and then at the day and time and place, you go to the vaccination center and do your vaccination. Every city in Portugal has at least one vaccination center. So the vaccination in Portugal is a process that interacts with the population. We also, in Portugal, had a plan developed according to the vaccination that were contracted by the European Union. We are integrated in the European Union, so the vaccinations are contracted to pharmacies by the European Union, and they are sent to Portugal, doing along with that criteria that European Union established for every country. The system that is responsible for the administration of the vaccine, as I said before, is the National Health Service that provide and administrate vaccines in the vaccination centers to around the country. When the vaccination started in Portugal, we have to, as I said, develop a plan. And the plan was to give the most or the biggest number of vaccines to the people as fast as we can. So we purge different types of vaccines so that we can maximize that objective of giving the vaccines to the population. So when we got to vaccines, we have to get a strategy that could provide some impacts or immediate impacts on the COVID-19 disease in Portugal. So as we get the vaccine, we develop a strategy to supported by the technicians and the scientific commission that were established for this plan. So we start with the people that were most exposed to the disease. So we define priority groups, and those priority groups were the elder and the healthcare personnel and law enforcement and some other groups, firemen, other groups that work in the most important and most structural areas for the country to respond to emergency, to respond to healthcare. So we made this strategy and we implement this strategy and try to make the most of the vaccination progress to impact directly on this person, especially on the healthcare. So until today, we have received more than 8 million vaccines in our country, and we have given more than 17 million vaccines to the population. By today, with the first doses, we have more than 4.5 million people. There is 45.65% of the population in Portugal until the 20th of June. And with complete vaccination, we have almost 3 million people, 28% of the population. So for now, we have almost 95% of the elder population with the complete vaccination. One important thing and one important detail on this vaccination is the vaccination is free, but it's not mandatory. If anyone doesn't want to take the vaccine, no one can make them take. So it's almost impossible to get 100% of the population vaccinated. But as you all know, our major goal is to get to from around 70% of the population with the complete vaccination, so we can get group immunization. So that's our main goal. We don't have illusions. We know that we can get to everyone because it's not an obligation to get vaccinated. So you can see in this map the ratios of the vaccine in the different parts of the country. We are in the north. So for age group, as I said, with the complete vaccination, we had 93%. So this was on the 20. So today, probably we are almost at 95% of the population with complete vaccination for people more than 18 years old. So you now get a picture that is the most important group is from the 15 years ahead. And for that group, the small or the minor value is 45% of the population from the 15 to the 64 years old with complete vaccination, but 73% of that population already has the first dose of the vaccination. In Matosinhos, 32.25% of the population is already had the first dose, and 22.16% has the vaccination completely. We administrate approximately 2,000 vaccines per day, 6 to 7 days a week. That's variation has to do with the number of vaccines we have available in that week. The impact of COVID-19. Well, the impact of the vaccine in the COVID-19 disease is the enormous decrease of the admissions in hospitals, in infirmaries, but especially in the ICU. We have a decrease of around 18 of the people in the ICU units. So since the beginning of this pandemic, we needed to focus on the rapid response to the COVID-19, and the rapid response became from the scientific community with the development of the vaccines. That fast development of the vaccines were essential for us to control the pandemic. The pandemic origin is a virus, and the virus we treat virus, or we control virus, better said, with vaccination. So the vaccination made a serious impact on, as I said, hospitalizations, and a serious impact on deaths, because the most fragile population were the first one to get vaccinated, and the impact of the vaccine is very important. We still have some cases of elder people getting the disease, but the impact and the symptoms are very small. They didn't need hospitalization until now. So we started our vaccination program in May. Yeah, I think it was in May. So until today, we only had 2 deaths related to COVID-19 with people who were vaccinated with the complete vaccination program. But those 2 deaths we had were people who have a reinfection and only get 1 vaccination doses. So the real impacts of the vaccine in the COVID-19 in Portugal was a very significant one. Today, we are living in Portugal a 4th wave of the COVID-19 virus, and the population affected by the COVID-19 virus are the younger population, because they are the ones who aren't vaccinated yet. In Portugal, we are now starting to, in the 4th of July, we're going to start vaccination people from 18 years old until the end. So the 18 years old population will have the opportunity of getting the vaccination too. So we expect that the vaccination will impact in the 4th wave of the virus with a strong impact. So here in Portugal, the vaccine is not the only response to the COVID-19. It's the major response, but we still had the mandatory obligation of the use of masks in or outdoor. Personal distance is still obligated also, and the limit capacity of people inside and outside events, among very other measures that we had to control the disease. We expect that in this year we have the possibility to prevent this emergency and be able to get population in a more normal sense of life, if we can get that vaccination program to roll like it is rolling today, and we can open our lives to the life that we know until March of 2020. So we are in a very long program or a very major program of vaccination. We never did anything like this before. It's a very, very important context that we are dealing, and this is being coordinated with the European Union. It's been coordinated with the pharmacies, and we are expecting that until the end of August, we have that goal that I talk about, that 70% of the population will have the vaccination complete. It's a very ambitious goal, we know, but we are making our most big effort, and we are all very, 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 very much committed to this goal, and we hope to get it, because the vaccine is a very, very important step. The vaccine has been so long that we are waiting for so long for this solution. We were waiting for so long for this opportunity to get our lives back, the life that we know, the contact with other people, the possible of traveling. And now we are working very hard to make that possibility back to us, to make us able to do that again. But for that, we need to get vaccinated, is the major response. We have to get vaccinated. We have to get this virus under control, and to get the virus under control, the immunity group is a very, very important, it's a precious goal that we have to achieve. So I'll thank you, all of you very much for being here, to give me this opportunity of sharing with you what we are doing in Portugal, how we are doing this vaccination program, how we are progressing with the vaccination. And most importantly, it's I would like to leave the message to everyone in the audience that vaccination is a very, very important step. It's a major step to get our life back. It was an opportunity for us, and in civil protection, to acknowledge the response and the needs of to get the needs of the population in this period. It was a very difficult period for us. The population suffered a major impact on on their lives, because some people lost their jobs, some people lost their businesses. Everything was in a stop. It was just like that. Many businesses were in very, very difficult times, and the municipality of Matosinhos and all the municipalities in Portugal needed to help those people, and needed to get strategies to make them able to sometimes survive this pandemic in their businesses. So this was a very, very difficult time. We all engaged in this last 1.5 years. And I hope that with the vaccination progress and the impact of the vaccine in our population will let us get our life back, and will let us get strong and make everything possible again, and the business will get back, and people will get their lives back. So thank you very much once again. And if anyone has any questions, I'll be able and available to answer them.
Ramakant sir, can you please check if anyone has any question?
Oh, just there is no question.
Yes.
Only lots of thanks are here. Very information. Feedback are there. The presentation was very nice.
Yes, sir. Can I ask something?
Yes, please.
Susana ma'am, whatever data you have present, I have seen that almost 98% people vaccinated. That is 80 plus aged people.
Yes, yes.
And about 65 plus aged people, they have also a good number of people has been vaccinated also. And my question is, what kind of vaccine you are using, like Pfizer or Moderna? Which company?
We are using them. We are using them all. For the population, for the male population from the 18 years old, we are using Janssen, Pfizer, and Moderna. For the 65 years old ahead, we are using AstraZeneca, Janssen, and the others, Moderna and Pfizer. For women, we are only use Moderna and Pfizer until that age, 65 years old. For though we are using these four vaccines in Portugal, because these four are the vaccines that are approved by the European Agency for Pharmacy.
Is there any guideline for vaccination of childs?
We are starting from the 4th of July with the 18-year-old ahead. For child, we still don't have any information about the vaccination progress. Under that age, under 18, no, we still don't have any indication.
One more question. You have told that fourth wave is running on in Portugal.
I didn't understand the question, sorry.
As you have discussed that fourth wave, COVID-19 fourth wave is coming in Portugal.
Yes. We have a fourth wave now in Portugal, mainly in Lisbon, in our capital and that region. But we have several cases there. We are now having 1,050 cases a day. And we are now clearly on a fourth wave with less admission in hospital, with less death, and until today less cases too, but clearly a fourth wave in Portugal.
So what is the time gap between third wave and fourth wave?
Well, this one was the largest time in between waves. It was like 1 month, 1.5 months between the end of the third wave and the beginning of the 2 months. The end of the third wave and the beginning of the fourth wave.
Thank you.
Between the second and the third, we almost didn't notice the difference between the waves. In Lisbon, when they were in the end of the second wave, in the north, in Matosinhos and Porto and the other cities in the north, we were already on the third wave. So it was a very, very lack of time. This time it was a longer period between the third and fourth wave.
Thank you.
You're welcome.
Yes, Rajas.
Okay. Thank you, ma'am. Thank you, sir. Now, I would like to call our keynote speaker, Mr. Gildas. Mr. Gildas has a master's degree in applied biology, that is bacteriology and virology. As of now, he's pursuing PhD in biology and human science from the University of Chad, and also serving as a scientific laboratory technician at the Ministry of Public Health in Chad. Now, I would like Mr. Gildas to share his valuable information with everyone. Over to you, sir.
Okay. Hello. Good morning, everybody. It's a pleasure for me to join this webinar organized by Universal Talk and the Columbia University. I don't know if you get me. Do you get me, Ojas?
Yes, sir. You are
Yes,
audible.
you are audible, sir.
Okay, so my name is Gildas. I am from Chad. Chad is a central country in Africa. And we are one of the biggest country in Africa, largest country. And so it's a pleasure for me to share my knowledge with you and to share what I know about the vaccine with everyone. When Mr. Ojas contacted me, so I was asking myself already, but I will try my best to give some information about the vaccine, as we are going to talk about the role of the vaccine in the COVID-19 prevention and how we can wade through misinformation and mistrust. I don't know if Mr. Ojas, I can share my screen, please.
Ramakant, sir,
Please,
no.
please start screen share.
Can I share it, please?
Sure, sir. You can start screen sharing.
Okay. Just
Zoom is revolutionizing the way teams collaborate, whether you're connecting multiple conference rooms or adding remote.
I don't know if everybody can see what I'm showing. Is it okay?
Is it okay? You can visit.
Okay, addressing prevention, how to wade through. Okay, thank you, sir. I made a little plan that can help us to understand the role of the vaccine and in this situation we are living now in the world, COVID-19. Firstly, we're going to talk about the vaccine to give some definition and the function inside the organisms. And then we're going to talk about how the vaccine are developed. We're going to talk about the safety and the quality control. Then we will talk about the COVID-19 vaccine. We will see the effects of the virus variant and the side effects of COVID-19. Then at the end, we're going to see the role of the vaccine in the COVID-19 prevention. Then we will give some recommendation if it is possible. So at the end of this webinar, we need all the participants to understand what the vaccine is important to do in our organism, to understand the vaccine manufacturing process, to understand the effort of organizations to fight against infections, and then to break with the misinformation. Firstly, what is a vaccine? Vaccine is a biological preparation administered to the living organism in order to stimulate his immune system, to develop also the adaptive immunization, which protects against infectious agents. And let us talk about how the vaccine is developed, and how is it working inside organisms. It is very, very important. Let us see this picture. When the antigen or the pathogen enter the body of a human being, we can see all this kind of process in the organism. Directly, we can see that our organism start to do or to fight with this pathogen in doing this. The antigen enter the body and automatically, we have the antibodies that are made automatically. Then they grab onto the antigen and they defeat it outside of the organism so that we cannot be affected by this pathogen. And then the vaccine. Let's talk about how the vaccines are developed. It is very, very important to understand this part, because sometimes when people don't know how the vaccines are developed, they can give information that are not true. just to put other people in a mistrust. That's why it is important for us to talk about the vaccine components. So the vaccine components, firstly, we have the active component that we call antigen. And these antigens generate the human response, or the blueprint for making the active component. The antigen may be a small part of the disease-causing organism, like a protein or sugar, or it may be the whole organism in a weakened or inactive form. Then we have the preservatives. The preservatives, let's say that the vaccine the preservatives prevent the vaccines from becoming contaminating once the vial has been opened, if it will be used for vaccinating more than one person. This is the role of the preservatives. Then we have also the role of stabilizers. The stabilizers prevent chemical reaction from occurring within the vaccine and kept the vaccine component from sticking to the vaccine vial. Then we have surfactants. The surfactants, they have the role. That's very, very important too. Let us talk about the surfactant. They keep all the ingredients, like the components that we talked already about. They keep all the ingredients in the vaccine blending together, because all the components, they have to blend together to strengthening also this the vaccine. Then we have the residuals. The residuals are the tiny amount of various substances used during manufacturing or production of a vaccine that are not active ingredient in the completed vaccine. Then we have diluent. The diluent is a liquid used to dilute a vaccine to the correct concentration immediately prior to use. The most commonly used diluent is sterile water. And we have at the end, we have adjuvant. The adjuvants, let's say that some vaccines also contain adjuvants already. An adjuvant improves the human response to the vaccine. And sometimes by keeping the vaccine at the, at the injection site for a little longer, or by stimulating local human cells. It is important to know that before introduction, all the vaccines are submitted to an extensive and rigorous testing to ensure that they are safe. So for the experimental phases of the vaccines, first, we tried it in the animals. We cannot test directly the vaccines in the human being because this is not permitted. We first tried on animals. Then vaccines are tested in human clinical trial in 3 phases that we're gonna see. The phase 1, the vaccine is administered to a small number of volunteers. We can have young people or healthy adults. And this first phase induces the safety and the human response and also the right dosage, because we have to dose this vaccine. And the first phase that can help us to know how we can dose the vaccine. The phase 2, in the phase 2, we have several hundred volunteers. They are all in the same characters. Then when we give when we give the vaccine, it helps us to understand and to know which kind of person we are vaccinated. This is the second phase of the vaccination testing. And multiple trials, in this phase, is to evaluate various age groups and different formulation of the vaccine. Also, the phase 3, this is the last phase, and it is very, very important to understand this phase. In this phase, we have more than thousands of volunteers that receive the vaccine. And we have also another group of persons that receive something that is not the vaccine, but it is the comparator products. What is important at this stage is that most of the time, phase 3 trials are conducted across multiple countries. We can, so we have maybe in the first time, we can stay in the same place and only one country to try to do the vaccine. But so when we come to the phase 3, it is very important to go across every country, more than one countries, to try this phase 3 and multiple sites of experiences within a country to assure the findings of vaccine performance apply to many different populations. And what is very, very important to remark is that during the phase 2 and the phase 3, none of the volunteers and the scientists, no one knows who received the vaccine and who received the comparator products. That's very, very important to understand, because this can help us to know what the vaccine can do inside the organism. If we give to all the groups of the person, if we give them the vaccine, it will be very, very difficult for us at the end of the experience to know who received the vaccine, who did not receive it, because it will be very, very difficult for us to make this kind of difference. That's why no one knows who received the comparator products and who received the vaccine. It is very, very important to understand that. Also, let's talk about the manufacturing and the safety and also the control, the quality control of the vaccine. Once a vaccine has reached the pre-approval stage following clinical trials, so we have already talked about the clinical trials in 3 phases, it is assessed by the relevant regulatory body for compliance with quality, safety, and efficacy criteria. Okay, let's come to the COVID-19 vaccine. What is the real subject of this topic? Because we are now in the COVID-19 period, and it is very important for us to know what is the COVID-19 vaccine. We have different types of vaccines. There are 4 types of vaccines in clinical trials right now. We have the whole virus of COVID-19, and we have also the protein subunit. We have also the viral vectors. We have also the nucleic acid. The nucleic acid is what we call the genetic material of the virus. We can use this also to do what we call the vaccine, the COVID-19 vaccine. You can see these images. We have the material, the genetic material. It is very, very important to understand that. So it is this genetic material that help the virus also to make some variants form, because inside the organism we can see that the material, the genetic material, can be mixed with the body, and then it can change anytime. It is very, very important to understand that. So we can use also the material, the genetic material of the virus to do the vaccine. And that helps to understand what the virus is going to do inside the organism. Okay, the effects of virus variant and side effects of COVID-19 vaccine. All viruses, including the SARS-CoV-2. The SARS-CoV-2 is this virus that causes the COVID-19. It changes over time. That's what we call the mutation. One or more new virus mutation give what we call the variants of the original virus. WHO has been tracking mutations and variants since the start of the COVID-19 outbreak, because the SARS-CoV-2 that we talked already about is an old virus. It is not new. That's why WHO has been tracking mutation and variants since the start of the COVID-19 outbreak. The global SARS-CoV-2 laboratory network includes a dedicated virus evaluation they are working together, which aims to detect new changes quickly and assess their possible impact. Now, we're going to talk a little bit about how to weigh through misinformation and mistrust. First, let's say that we are about 1.70 million of cases of COVID-19 cases in the world, and we have about 3.5 million of deaths already. So it is very important to understand also that in Africa we have more than 483 million of cases right now in Africa. And vaccine works by preparing the body's own human system to reorganize and defend against a specific disease. It is important to understand that right now we have a lot of misinformation that is in the media or in the social network. Everybody gets all of this kind of misinformation. It is very important to wade through this and to let people understand what is going on before we can talk about the vaccine right now. Okay. What is important about the COVID-19 vaccine is that first, we have the medical agents or those who are in charge of COVID-19 vaccination. They must listen with compassion to those who have questions. Sometimes when people come to us, I am one of the health agents, when they come to us to ask some questions, we are afraid and we try to avoid questions. We try to not respond to their questions, while it is very important to listen with the compassion to those people because they need to understand what is going on, the life change, and they have to understand what is going on before to believe in this situation, before to believe in this changing behavior in the life. Secondly, we have some questions could be asked to people. Even we can ask those people who don't understand what is COVID-19 exactly. We can ask them to better understanding their feeling about COVID-19, and then we can answer them. Example, what have people known about the COVID-19 vaccine? We can ask them this kind of question. And then they will ask, they will answer. When they answer, we can take this kind of response to help them understanding what is going on and why is it important to take the COVID-19 vaccine. Thirdly, we can give information, and we have to share information. It is very, very important. When we don't share the information, it will be difficult for us to let people believe in this vaccine. We must avoid rumors and give the trusted information. The example, let's visit the WHO website for information on COVID-19 vaccine. Fourth, let's talk about the reason of getting vaccinated, but not impose our opinion. Sometimes we think that it is useful to force people doing something, but when we force them to do something, they will see that they are forcing but they will not understand why they have to take this. We have to give them the reason why they have to take the vaccine. It is very, very important, this part. The role of the vaccine in the prevention. The role of the vaccine, we can say that the vaccine protects against infections. It helps organisms to strengthen the human system. And the vaccine protects all the community. We can see how the COVID-19 killed many people in the world. When we have some news from India, for example, the last news, we have more than 1,000 people a day. And this is very, very important to understand that so the vaccine can protect us, not only us, but it will protect also the whole community. If I am vaccinated, I am protecting first myself, and I will protect also my brother, my sister, and the whole community, and even the whole nation and the whole world is going to be protected. Because the world changed and we have many infections, it is very important to take the vaccination. Okay, I'm going to share with us the Africa experience about the COVID-19 vaccine, and we can make some recommendation at the end of this slide. Overall, the wrong information and all the frustration Africa and the whole world has gone through, getting vaccinated is very, very important. I can talk about my country. You know, when the COVID-19 started, do what they did never done before, them to change their manner to live. The way they lived before, they forced them to do what they did not understand. It was very, very important to explain the things to them with the love. When we don't love someone, we cannot give him the information to protect him. It will be like so the illusion for him when you force him. In my country here, when the COVID-19 started, so we shut down so all the markets and even the shops. We forgot that so in this country we are a poor country, and every day people are fighting to survive. They are going through the commerce, they are doing their own business to survive. But when the government closed all this kind of the practice, it was very, very hard for a lot of families. That's why it is very important to let people understand that so we are going, this is scourge, and it is very, very important to take the vaccination. And we have to repent because we did hurt to the people right now, and we come with the vaccine to vaccinate them. They don't believe us because firstly, we did not give them the condition. In my country, for example, no one went out during the vaccine, the COVID-19 period. And it was hard. Some families, they just died because of the starving, just because of hungry. You know, it was not very, very interesting. But right now we have the solution, that is vaccines. And we have to tell them with the love how much it is very important to take this vaccine. We recommend to WHO build confidence with the people. We propose some solution. We propose them by organizing some seminar or information to everyone, trying to train people, even those who are not health agents. We have to try to train them and to give them the right information. And we have to punish exactly all those who did not play normally their role during the time of COVID-19. This is very important. When we punish those who did not play their role, it will put the population in confidence. They will say that, so we are serious and we need really to protect them. And at the end, let us say that, so vaccination is a crucial step. Vaccination is a crucial step. Then, despite the record speed at which they have been developed, the COVID-19 vaccine have still been subject to the same checks, balances, and scientific and regulatory rigor as any other vaccine and shown to be safe. Now, let us ensure everyone that this COVID-19 vaccine is safe. We have to take it just to avoid this kind of scourge in this world. We have to protect ourselves and to protect our community. It is very important. So I am very glad to share this little knowledge with you. and it is a pleasure for me. I will close my topic with this talk from the Dr. Tedros Adhanom Ghebreyesus, who is the WHO secretary. He said, "This is a time for facts, no fear. This is a time for rationality, not remorse. This is a time for solidarity, not stigma." It is very, very important to think on this affirmation of Dr. Tedros. Thank you so much. And you can go through these reference sources to get information about all what we said right now. Thank you so much for hearing. Thank you, and I am ready. If there are some questions, I can answer. Thank you so much, Ojas. Thank you.
Thank you, sir. Thank you. Very well said, sir, that this is not the time for our views, but this is the time for the fact that we have to play our roles, and vaccination is so much important for our community. It doesn't save us, but with us, it also saves the community too. Thank you, sir. And now I would like to call our speaker, Dr. Mohammad Arif. Dr. Mohammad Arif has a master's degree in geography from Department of Geography, Aligarh Muslim University, Aligarh, India. He has completed his PhD from Department of Geography from Vishwa Bharati University, Shanti Niketan, India. He has various research papers and book chapters published, and he has various administrative posts accomplished. As of now, he is assistant professor in Department of Geography, Central University of Jharkhand, Ranchi, Jharkhand, India. Over to you, sir.
Sir, please unmute your mic.
Thank you, Ojas. I feel honored that you people invited me for this international webinar addressing the role of the vaccine in COVID-19 prevention, how to read through misinformation and mistrust, that organized by the Universal Talks and Columbia College, Raipur, Chhattisgarh. Before to start my talk, I would like to share my presentation. First of all, I will give a brief introduction of this COVID-19. That coronavirus disease, that 2019, that is abbreviated as actually COVID-19. It is one of the most infectious disease, and that has been originated from Wuhan city in Hubei province in China. And this virus has been rapidly circled all over the world, and that has been announced as a pandemic by the World Health Organization. And more than 213 countries and territories that has been reported confirmed COVID-19 cases. And initially it has been started in China, later it has been shifted in Europe and other countries. And thereafter this virus has been transmitted in United States of America and Latin American countries. So currently the highest infected and diseased rate in infected persons in USA, after that India. So COVID-19 cases, that positive cases in countries outside the China, that has been identified in those with no travel history to China, and that indicating the human to human transmissions. and that was taking place in these countries. So in this analysis, I have used actually 2020 data during the analysis. And our country, India, that has been second largest population with 120 crore, with 121 crore population next to China. So when that COVID-19 cases started to rise, then government of India has been announced a complete lockdown on March 22, 2020. And that complete lockdown has been to reduce the effects of the new coronavirus. And to minimize the effect and spread of the novel coronavirus, lockdown operation that has been conducted across the country. So in that time, there has been no pharmaceutical medications for the coronavirus vaccines, and a high transmission rate of this virus has been expected. So population density, this is a very much important, since it is directly affects the patterns of communications and interaction levels among the individual in a population. Theoretically, population density tends to closer contact and greater interaction between people, which makes the potentially hotspot for the high prevalence of emerging COVID-19 disease. And it is also found that a positive and significant relationship between the district level population density and infectious diseases. And we have found several studies that the population density has a large impact on these COVID-19 contagious disease through human contact. As India is one of the densest countries among the world, in the world, and according to Census of India 2011, the population density of India is 382 persons per square kilometer. Our study is basically based on the South Indian states. The South Indian states has been varied widely in terms of the population density. Where the slide is running?
Yes, it's ready.
So that diverse population density of the 5 South Indian states, that is Kerala, Karnataka, Tamil Nadu, Telangana, and Andhra Pradesh, that has been emerged as an exception over the last few decades. And these states have low birth rates and low death rates rather than other states. So population density, one of the most fundamental demographic attributes that could vary systematically with an abstraction scale. So according to 2011 census, the population density of Kerala, that is 860 persons per square kilometer, where the population density of India is 382 persons per square kilometer. And next to Kerala, the Tamil Nadu state, that is 555 people, and the remaining 3 states like Karnataka, Telangana, and Andhra Pradesh, they have 319, 312, and 304 population density. So you can see this. This is the infection rate among these 5 states. So the COVID-19 cases in Tamil Nadu, that has been highest, that is was 1,75,000 according to 20 July 2020 data. And Karnataka state, that has been 69,614, and after that Telangana states, that is 46,000, and Andhra Pradesh also 53,000 above COVID-19, and the last one is the Kerala state that has 13,279 infection in its 14 districts. So our major objective is to investigating the association of COVID-19 infection with the population density for the case of these 5 South Indian states: Kerala, Karnataka, Tamil Nadu, Telangana, Andhra Pradesh. So basically, this methodology we have been used, and the data totally we have used that COVID-19 India portal and official website of the Ministry of Health and Family Welfare till 20th July 2020. And population density data has been collected from the Census of India 2011. So basically, statistical analysis has been conducted to determine the correlation between population density and COVID-19 positive cases. And the district-wise data of COVID-19 infection and population density maps that has been produced totally in GIS environment. And inter-district variation that has been grouped with 5 categories: very low, low, medium, high, and very high. And or the 3 categories like high, medium, and low. And Pearson correlation coefficient, response surface methodology, and Thesin polygon method or Voronoi method that has been applied to examine the association between the number of COVID-19 infected cases and population density. This is the study area. You can see. And these 5 states has been very good in the sense of the hospital infrastructure or health infrastructure. There is good number of hospital beds, ventilator, and others. So you can see the Kerala that has been located among the southwestern part of the Indian landmass, and Tamil Nadu that is 11th largest state in India, and with a population of 7 crore and above population. Then thereafter Karnataka that has been located in southwestern part of India, and Telangana state that has been carved out the earlier Andhra Pradesh, and that has been established in the Indian Union as the 29th state. And last one is the Andhra Pradesh state that is located in southeastern part of the Indian subcontinent. So you can see that the infection rate that COVID-19 positive cases in India on 20th July, that is 11 lakh and above. And among these 5 South Indian states, Kerala has the lowest positive cases and highest recovery rate from this infection. And however, the mortality rate is little bit low in South Indian states rather than the other parts of the country. So that whole South India regulates the pandemic more deeply than the other Indian states, and that cases has been rising sharply in Tamil Nadu, but mortality is relatively under low. So Telangana has only 422% that they have been lost their lives. And Tamil Nadu, another powerful COVID-19 fighter, they have 1,75,000 reports with 1.45% fatalities or death rate. Following, you can see that this table, from there you can easily understand the fatality rate percentage of the disease. So next one is the discussion of the correlation between the population density and COVID-19 positive cases. And a strong positive linear association we have found between population density and COVID-19 in Tamil Nadu, where R is equal to 0.98, where Telangana has been 0.99, Karnataka state 0.99. However, we can found that the moderate positive correlation between population density and COVID-19 positive cases in Kerala. And in the case of the Andhra Pradesh state, that we have found only very weak positive and statistically significant association between this population density and COVID-19 infection. Our findings also found that the number of confirmed cases typically increased in areas with high density, and thereafter areas with medium to low density. So next discussion is the spatial analysis between population density and COVID-19 infection. We have conducted a spatial study in different districts of 5 South Indian states and found that Tamil Nadu, Telangana, Karnataka, and Kerala have positive correlation between population density and COVID-19 positive. And the remaining Andhra Pradesh state has significantly and positively correlated between these two indicators. So you can see this figure that COVID-19 positive cases and the population density of the Kerala state. So Kerala, this is a small coastal state. They have been tried to cut down that COVID-19 infection, and most of the affected patients, they have been mainly found in the central and southern parts of the Kerala. And the district named the Malappuram, Thrissur, Ernakulam, and Alappuzha district, they have been maximum infection rate. However, this state has done a remarkable job that 95% of these infected people have been totally recovered, with the case of fatality rate 0.78%. Next one is the Tamil Nadu state. So Tamil Nadu has been recorded 1,75,000 COVID positive cases, which is the highest number in southern part of the India. And according to a state health bulletin, the Chennai district alone reported 87,000, with half of the total COVID-19 cases found in Chennai district. And initially in North Chennai, there is a market, Coimbatore market, that has been identified as a hotspot of the COVID-19. So later this market has been closed down due to high infection rate. And however, this state also have a low mortality rate, about 1.45%. Next one is the Karnataka state. That this state has been till 20th July 2020, that cases is 69,614, and which has been that the fatality rate or death rate is 2.02% among the South Indian states. Next one is the Telangana state. You can see that in the Telangana state, there has been spread has been done about 46,274%, 74%, and among them 74% people has been recovered, and 0.9%, means less than 1% people got diseased. And like Kerala state, this state also have a very low mortality rate, which is the second lowest in southern part of the India. And another state, that is Andhra Pradesh. This is a small state, but here infection rate is rather high than the other states. And in the analysis, it has been 53,724 positive cases till 20th July 2020, and the percentage of disease discharge persons and the fatality rate, that is 45% and 1.3%. In discharge person, 45% people discharged and 1.3% people has been died. And you can see the dark blue color that has been shows the higher population density, and yellow color has been high COVID-19 cases. So this is the basic demographic feature and the population density of and COVID-19 cases in this state. Next analysis is the response surface methodology for the COVID-19 and the population density. Basically, that state-wise data of population density, this total population and COVID-19 positive cases that has been considered as the study to analyze the South Indian states. And first one, that the Andhra Pradesh state, that you can see that the population density and total population in Andhra Pradesh, that is very much significant, but no significant interaction that has been observed between this input variable that has been affecting the total number of COVID-19 positive cases with a 3.09 and 3.766. The response surface plots depict also a good model of the fit, and that adjusted R square is 81.53%. And next, in the next figure, you can see that the contour plot as well as the surface plot of the 2D contour graph and 3D surface plot of this COVID-19 infection with the population density. So next state is the Karnataka state. Here also a significant correlation that has been found between the population density and total population. And adjusted R square is very good, 87.78 and percent. And the model fit that has been also confirmed low standardized residuals. And the 2D contour graph and 3D surface plots that has been demonstrated between these two variables. So you can say that equality of variance that has been exist between these different level of the response. And next state, that is the Karnataka state. The same thing, that here also a good number of the interaction we can found. Then Tamil Nadu state, that is another important state where the maximum level of the infection we have found, and that figure has been shows that the input data points as well as the residuals that have been close to the normal distribution, and this combined impact of the total population and this population density of the COVID-19 cases and corresponding 2D contour graph and 3D three-dimensional response surface that has been illustrated, that is clearly exists the different level of the variance. Next state, that is the Telangana state. So same, this here also COVID-19 positive cases that has a close significant value, and the response surface plot that has been demonstrated also a good model fit with R square and adjusted R square, and that also to analyze the combined impact of the population density and total population for the COVID-19 graphical representation of the 2D and 3D plot that has been clear for this COVID-19 infection. And we can say that the equality of variance that has been exist between different level of the response. So while interpreting all these response surface, it has been kept in mind that the plots are based on the prediction, and each predicted point has a confidence interval. And if the model error is known, then prediction variance can be determined. So the a response surface based on the half fraction of the 95% confidence that has been illustrated in figure 9, figure of the Karnataka, Telangana, Tamil Nadu, Andhra Pradesh for this state, and this three-dimensional response surface plot that has been rendered after the elimination of non-significant response time. So these plots provide an accurate geometric representation, also useful information regarding the behavior of the system within the experimental design. And our study also reveals that the COVID-19 positive cases is the response, while the population density of total population that are the two process variable with the significant level of P0.05. So I am going to conclude this matter that the new coronavirus COVID-19 disease that has been recognized as the most serious threat for the public health since the influenza pandemic of the 1918. And in general assumption that density is correlated with the high transmission rate, infection level, and mortality from high communicable disease such as COVID-19. And our study uses a systematic and recent approach to explore this connection between population density and COVID-19 in South Indian states. And this study investigates publicly available data from the COVID-19 India portal and state government portal to detect this emerging space-time distribution of the COVID-19 contagion. And regarding the inter-district spatial analysis from the South India, it is observed that the population density better explains the contagion effect. And this population density of Andhra Pradesh state did not reflect only corona transmission, but our empirical findings of this research found that the positive correlation coefficient represent the infection of the rest of the 4 South Indian states. And this confirmed case numbers that has been insufficient to recognize the true nature of the COVID-19 pandemic. So this response surface methodology model that has been implemented to analyze this, analyze the association between population density and COVID-19. And this main purpose that find out the hotspot of these South Indian states districts. So this compiling these data sets which include suspected, potential, and negative test numbers that can significantly boost monitoring efforts and our understanding of the transmission dynamics for this infectious disease. And we also understand that the importance of the maintaining observation on emerging and active districts during this pandemic, and effectively ignoring the preceding districts that do not present a serious threat to public health. So these demographers can play a serious role, a crucial role in the mitigating this spread of this disease. So our findings also help the planners' role in taking steps for tailored to the society enforce social distance measures more effectively. And these findings also suggest that the time frame of the pandemic spread that is based on the multivariate population density analysis that may be useful for the intervening planning during the possible future pandemic, like a second COVID-19. Already it has happened in it. And this advancement of more accurate, reliable model in terms of the scope and prediction in the battle of the COVID-19 disease that will allow these policymakers to better conceptualize pandemic and implement proper and more efficient policies. So our analysis can help the district official, those who can identify the COVID-19 pandemic hotspot and prepare a new strategy to follow the World Health Organization guidelines like teaching, testing, tracing, and treatment. Thank you, all of you.
Thank you, Arif sir. Thank you, Arif sir, for your valuable information. And now I would like participants to ask questions if they have any. Ramakant sir, can you please check if there are any questions in the comment box?
There is one question for Susana ma'am. Hello.
Hello.
Hello. Susana ma'am, Lokesh Kumar is asking, is there any information about vaccination of disabled children?
I'm audible or just, am I audible?
Yes, sir, you are audible, sir.
Lokesh Kumar is asking to Miss Susan ma'am, is there any informations about vaccination of disabled children?
Sorry, I didn't realize that question was to me. No, we have not yet any information about the vaccination to young children. We don't have any information by now yet.
Susan, ma'am, is there any guideline for taking vaccine for lactating mothers?
I didn't hear the question. Sorry.
Any guideline for vaccination for lactating mothers?
They are in the same group of the vaccination. We don't have any restriction for them to the vaccine program.
Okay.
The only criteria that we have is that the Janssen vaccine can only be administered to men from 18 years old, and AstraZeneca to the elder people. That's the only restrictions we have here in Portugal by now. And under 18 years old, we don't have yet any information about the vaccination program.
Thank you. Thank you.
There is one more question in chat box asked by Yogita Tolani ma'am. She is asking that after being vaccinated, we make sure second and third wave. Vaccination is working in second or third wave, this existing vaccination. Dr. Mohammad Arif, sir, this is a question for you.
Can you tell me again this question?
Yes, sir. The existing vaccination is can save us in second or third wave. We are now listening that third wave is coming in India. So existing vaccination is can protect us from the third wave.
Okay. Actually, currently that only near about 20% population in India, they got first dose. Only 4% population got second dose. Vaccination for this large population. If this speed will increase, then this third will not fatal. That vaccination is very much important to get relief from this COVID-19. Only vaccine can save this mankind. Otherwise, everybody got infected.
Thank you, sir. One more question, sir, for Suzanne ma'am or for sir also, Gildas sir. Sir, there are so many types of vaccines available across the world. So as Suzanne ma'am addressed in her address, she told that they are giving different types of vaccines to different types of people in Portuguese. So these different type of vaccine affect differently in the body. Is it actually we are not in the science background, we don't know this type of understanding. So please, if you give some insight on us.
Well, the restrictions for the AstraZeneca vaccine were healthy issues around the world with the vaccine administration to younger people. So in Portugal, the reaction or the adverse reaction of the vaccination progress has been marginal. It's not significant effects, but we follow the guidelines from the European Union and the World Health Organization. So That's why we have now some restrictions for different types of vaccines. The Pfizer and the Moderna vaccines are the ones who don't have any restriction and can be applied to everyone, male, female, and whatever age. The other ones that we administrate in Portugal, the Janssen and the AstraZeneca, we follow the guidelines from the OMS and the European Union. I don't know if I answer your question.
Thank you, ma'am. Gildas, sir, will you please give some insight on this question? Whether these vaccines, available vaccines all across the world, affect the body or affect the younger ones or the elder ones or in middle-aged people differently? Because you are working in this field and this is your research area.
Okay, thank you so much, Abel. This kind of vaccine, so we have here is AstraZeneca in N'Djamena in Chad. Some information around the vaccine. Wrong information, but here, so we don't have effects inside the body. I took already my vaccine. I did not see effects so you're talking about. But it is, as I said before, it is safe. It's safe, and we have to trust and to not continue to believe all this kind of information, wrong information we have around the vaccine. I don't know if did I answer your question about?
Yes, sir. Yes. We should rely on vaccines and go ahead to save the entire humankind. Thank you so much. There are no more questions in the chat box. Everyone congratulating all these speakers, and they are give their regards and gratitude for the insights all of you have given us. So I think all the people who are listening us understand and know the objectives of webinar. So just now you proceed forward for the next step.
Now we are going towards the end of the webinar, and I would like to inform you all that now you will receive the feedback form, and you have to fill the feedback form. The feedback form will be open till 4th of July, and then you will receive your certificate in 3 or 4 working days. Now I call Dr. Abha Dubey for the vote of thanks.
Thank you so much, Ojas. Warm greetings to all of you once again. As I noticed that everywhere across the world, as we are meeting the people, there are situation, and everybody is in panic and fearful. Everybody is in fear. So this is our combined effort to remove this fear and save the entire mankind. So before proceeding to the vote of thanks, I would like to pray to God to save the entire mankind, to save the entire humanity from this deadly disease, so that we can live the normal life, we can back to the normal life situation. So I pray to God. It's an honor to have been asked to offer a vote of thanks on the occasion of international webinar on behalf of Columbia College and the Universal Talks. I, Dr. Abha Dubey, express my sincere gratitude to today's chief guest, Honorable Susana Goncalvas, experience and knowledge with us. Vaccination and for preventing us for importance of getting the vaccination to prevent us from this deadly disease. She also explained the role of individuals to save themselves in this pandemic situation. Thank you so much, ma'am. I appreciate today's keynote speaker, Honorable Gildas, sir, for explaining COVID-19 in very different perspectives and creating awareness about vaccination. He shared with us the role of vaccination and also the function of vaccines inside the body, the process of developing the vaccines, effects of virus and their variants and the side effects, and how to deal with the misinformation that and the rumors that prevalent in the society, and we should believe on the most trusted sources. So thank you so much, sir, for your guidelines and suggestions. We are very grateful to you. I also express my sincere thanks to Honorable Dr. Mohammad Arif, sir, who enlightened us with his knowledge and wisdom. And sir has clearly explained to us the population density and the relationship between the population density and COVID-19 and spread of viruses in Tamil Nadu state. Your work is very nice, sir, and the way you present with us, it's very well. So I express my heartiest thanks to you, sir, and the management of Columbia College and Secretary Honorable Sri Harjit Singh Hora, sir, who is being us for making this webinar a grand success. Thank you, sir, for your support and guidance. I feel very honored to give my thanks to all the participants and dignitaries who have supported us and accepted our invitation for present in the webinar. The support of the entire Columbia family, the members of the Universal Talks, and their enthusiasm to organize this webinar for noble cause to save the humanity by our small efforts. Thank you, everyone. No matter what language we speak, a kind and smiling thank you always speak to everyone's heart. Thank you so much. And I invoke all the people here or across the world to identify your potential, to identify yourself, to identify your energy to fight with this disease, and will have definitely fight with this disease and will definitely win from it, or win with the flying colors. So with this note, with this positive note, I will complete my vote of thanks here and ask Ojas to further the proceeding.
Thank you, ma'am. And once again, I thank every panelist and every participant that they are here. And as I have told, the feedback link will be shared and everyone will get their certificates after 4th of July when we will end the feedback. We will end the submission of the feedback form in 3 or 4 days. Thank you, everyone.
Thank you, Susana, ma'am. Thank you, Dr. Mohammad Arif, and we'll like to associate with you all for this knowledge sharing platform. We'll call you, or we want your support to fight with this disease. Thank you so much.
Ramakant, sir. Sir, we stop YouTube live, madam.